Please perform a cardiovascular examination on these patients.
Hello, I'm Kirtana. I'm a medical student here. Can I just confirm your name and date of birth, please?
Thomas Burnell, 18th of March 1999.
And is it alright if I call you Thomas?
Yes, that's fine.
Brilliant. So Thomas, today I've been asked to perform a cardiovascular exam on you. So this is just going to involve me having a look at your hands, your face and your chest, and just having a listen to and a feel of your chest. Is that alright?
Yes, that's fine.
Brilliant. And before I start, are you in any pain at all?
No, I'm not.
Okay, so I'm just going to wash my hands and could you lie back on the bed for me, please?
Okay.
On general inspection, the patient is conscious and seems to be breathing comfortably. He has a normal colour, so there are no signs of cyanosis or anaemia. There are no items of note around the bed, such as an ECG machine, oxygen, or any medication such as the GTM spray. I'm now going to move on to examine the hands. Can you just put your hands out like this for me, please? I'm examining the back of the patient's hands for any signs of tendinous xanthoma, which would be indicative of familial hypercholesterolemia. I'm also going to examine your nails for any signs of splinter hemorrhages, which would be indicative of bacterial endocarditis, and also for any koilonychia, which would be indicative of iron deficiency anemia. Can you just please flip your hands over like this? I'm assessing the patient's hands for any temperature changes, and I'm specifically looking for sweatiness or clamminess. I'm looking at the palms for any signs of Janeway lesions or Osler's nodes, which would be signs of infective endocarditis. I'm also looking at the fingers for any tar staining and for any peripheral cyanosis. I'm now going to check for signs of finger clubbing by checking for the presence of Shamross window. Can you please put your fingers together like this? There is no loss of Shamross window, so no indication of finger clubbing. I'm now going to check the patient's capillary refill time. Can you put your hands out like this for me, please? I'm just going to press down on your fingers, but this shouldn't hurt. Is that all right?
Yes, that's fine.
It takes less than 2 seconds for the colour to return to the patient's fingers, which indicates a normal capillary refill time. I'm now going to assess the patient's radial pulse. Can you put your arm out like this for me, please? The patient has a regular pulse with rate of 72 beats per minute. Its character is neither bounding nor thready. If I was unable to feel the radial pulse, I would then move on to feel the brachial pulse. I'm now going to assess the patient for radial delay. Can you put your arms out like this for me, please? There's no difference between the left and right side. So I'm now going to check for the presence of a collapsing pulse. This is going to involve me feeling for your radial pulse and then lifting your arm above your head, and it would be indicative of aortic regurgitation. So before I begin, have you got any shoulder or arm pain?
No, I do not.
Okay, can I have your arm, please? Relax it. Thank you. So I would have been checking for the pulse to get any weaker, which it didn't. At this stage, I would also measure the patient's blood pressure, either using an automatic cuff or a manual cuff if the patient's blood pressure was too high or too low. Now I'm going to take a look at the patient's face. He hasn't got rosy cheeks or a bluish tinge to his face, which is known as mitral facies and would be indicative of mitral stenosis. I'm going to take a look at the patient's eyes. There are no visible signs of corneal arcus or xanthelasma, which are fatty deposits in the corners of the eyes, which would potentially be present if the patient had hyperlipidemia. I'm also going to look for yellowing of the sclera of the eyes, which is seen in jaundice. Would you be able to pull down your eyelids for me, please? Now look up. I'm looking for any signs of paleness of the conjunctiva, which is seen in anemia. Okay, thank you very much. Now would you be able to open your mouth for me? And raise your tongue to the roof of your mouth. Okay, thank you, and then stick out your tongue. Thank you. There are no signs of central cyanosis. There is no glossitis or angular stomatitis, which is seen in a vitamin B12 deficiency, and dentition looks good. Could you take your shirt off, please?
Yes, of course.
I'm now going to have a feel for the pulses in your neck. Is that all right?
Yes, that's fine.
Thank you. Carotid pulses have a regular rhythm and rate. I'm going to use the bell of my stethoscope now to have a listen to your neck. Is that okay?
Yes, that's fine.
When I put my stethoscope on your neck, would you be able to hold your breath for me, please?
Okay.
Breathe normally and hold your breath again, please. And breathe. Thank you. I'm now going to assess the patient's jugular venous pressure. Could you turn your head to the left, please, for me? I'm looking at this area for any signs of pulsation, which I cannot detect. The patient doesn't have a raised jugular venous pressure. Thank you. You can turn your head back now. On closer inspection of the chest, there do not appear to be any scars, which could indicate previous surgery such as thoracotomy or stenotomy. There is no pacemaker inserted and there are no visible pulsations. There are no obvious chest wall deformities. Would you be able to lift your arms up for me, please? Thank you. I'm now going to have a feel of your chest with my hand. Having a feel for the apex beat. And a parasternal heave, if present. I'm now going to check each of your valves for thrills. So the aortic, pulmonary, tricuspid, and mitral. Thank you. Can you just lift your bra up with your bra strap, please? Thank you. Brilliant, thank you very much. Alright, could you just lift it up again for me, please? Thank you very much. I'm now just going to listen to your chest. Just breathe normally while I do so. Aortic valve. Pulmonary. Tricuspid valve. Mitral. I'm going to have a listen to your apex beat now. Thank you. And could you just lift your left arm up for me? Just going to take a listen to the exam. Brilliant. Thank you very much. Could you just lift your bra strap up for me, please? Thank you. And could you just lift your arm up for me, please? And could you move your bra over to the right, please? Thank you very much. Brilliant, thank you very much. I'm now going to perform the accentuation manoeuvre, which involves me placing the diaphragm of my stethoscope over the mitral valve and having a listen for mitral murmurs. When I put my stethoscope on your chest, I'm going to need you to roll over to your left. Is that all right?
Yes, that's fine.
Okay, roll over for me. very much. Could you just lift your bra strap up for me, please? When I put the diaphragm of my stethoscope on your chest, could you roll over to your left for me? Thank you. I'm now going to perform another accentuation manoeuvre, in which I place the diaphragm of my stethoscope over the patient's tricuspid valve and listen for aortic regurgitation. So when I place my stethoscope on your chest, I'm going to ask you to sit up for me. Is that all right?
Yes, that's fine.
Brilliant. And sit up now, please. Brilliant. Thank you very much. Can I just ask you to sit up now for me, please, and lean forward?
Yes.
I'm just going to have a listen to the base of the patient's lungs for any crackles, which would be indicative of pulmonary edema. Just take deep breaths for me, please. And again, please. Thank you. I'm now going to check for any signs of sacral edema. I'm just going to have a feel of the bottom of your back. Is that okay?
Yes, that's fine.
Thank you very much for that. You can now sit back and put your shirt back on.
Thank you.
Can I also get you to take your shoes and socks off for me, please, so I can check for any swelling and the pulses in your feet?
Yes, of course.
Thank you. I'm now going to examine the patient's ankles for signs of peripheral edema. There is no signs of any fluid buildup and therefore no peripheral edema. I'm now going to have a feel of the pulses in the foot and ankle. I'm going to start off by feeling the posterior tibial pulse. And I'm now going to feel the dorsalis pedis pulse. Both pulses have a regular rate and rhythm and have a good character. So that completes my examination. Thank you very much. You can now put your shoes and socks back on.
Thank you.
So today I performed a cardiovascular examination on Thomas Bernal, a 20-year-old male. On general inspection and inspection of his face, arms and chest, I could detect no cardiovascular pathology. All pulses in his neck, arms and feet were normal, and palpation and auscultation of the chest was also normal, making this a normal cardiovascular examination. To complete my examination, I would do a 12-lead ECG, take the patient's temperature and assess for any peripheral vascular disease, also look at any imaging. Thank you very much.
Thank you.